So surgery, a reality.
That's right. We just heard Alexis talking about that. The Da Vinci Xi is one of the most advanced robotic surgical systems available in the world, and it replaces, as you heard them speaking about, large incision abdominal surgeries with a minimally invasive approach. Now, the robot, you guys, it allows surgeons unprecedented close-up views of the area that they're working on. So what would happen, you know, in the past is they would have to split people completely open. Now with this robot, it is incredible. They can go in and target these areas with way quicker recovery time.
Right, and what's so great about that, as we mentioned before, is my dad had stage 4 colon cancer, and he had to go in and get surgery and have a portion of his colon removed. And now every time he looks in the mirror, he has that scar. That is just a constant reminder of that very vulnerable time in his life. So this is great. This is great for them.
It is, and this is it's no longer a reality, having those large scars. And I met up with one of the first surgeons across the globe to use the Da Vinci Xi. It's colorectal surgeon Dr. Benyamine Mizrahi of Menorca Medical Center. Now, 9 out of 10 people whose colon cancer is discovered early will be alive 5 years longer than those who are diagnosed later. And I spoke with Dr. Mizrahi about how the Da Vinci technology is changing the way, you guys, that he treats his patients and what it means for their recovery time and ultimately what it means for their survival.
When surgery first came about, you had to get your hands in there and make a big incision, and then that evolved to, you know, minimally invasive. So literally it's trying to make the patient recovery better, so make smaller incisions, quicker recovery, quicker back to normal function. The robot is truly, it's the latest technology with the least invasive capabilities, and you're able to do big surgeries with small incisions, and not only that, you have great tools to be able to do the procedure. So for me as a colorectal surgeon, I deal mainly with colon cancer, rectal cancer, and anal cancer, so that's my expertise, and I'm able to, you know, with the robot, I'm able to take out somebody's entire colon, someone's rectum, anything that's affected by the cancer. And again, I'm able to do a very good cancer operation, and they recover quite well. Most common question I get is, well, you're going to be doing robotics, but I want you to do the surgery. Of course I'm doing the surgery. The robot mimics my movements. So it's not that at this point in time a robot can do the surgery without the surgeon. It's very precise and allows me to get, for me, in deep places where it's very difficult, even in an open procedure. So I'm able to move my arms, and it's able to do what I need to do in a precise manner. We know the anatomy. We know how to do the surgery. It's just a technique, and you want to go to the surgeon that you're comfortable with, and you want that surgeon to do the technique that they're comfortable with. Once you get used to the equipment, now I wouldn't do it any other way, because it allows me to do such a precise surgery. I have everything in my view. I'm able to do the surgery with minimal complications, and the best part, the patient is able to do so much better. So I offer it to any patient that I think needs an abdominal surgery.
What types of reactions are you getting from your patients who have utilized this?
Oh, they've, you know, at first they were skeptic, you know, in terms of me not doing the surgery. Once I've assured them, I mean, they're ecstatic. One, I'm able to do a good cancer operation, potentially cure them, avoid them a permanent bag, and then they get back to I tell them, a functioning member of society quickly, and they have less pain, quicker recovery, less hospital stay. So overall, they're very pleased. From an insurance standpoint, from a patient standpoint, there is no difference. The only difference is from the other side is doing what I believe is a better surgery and quicker recovery. The biggest thing with the Xi for colorectal surgery, it opened up the entire abdomen. The previous generations of the robot, it was more of in the pelvis, where the Xi for colorectal surgery has made it available to use it in multi-quadrants. And because of that, now you're able to do other surgeries in that similar fashion. So I think more and more specialties are starting to do robotic surgery.
Dr. Mizrahi was not only one of the first in the world to perform surgery using the Da Vinci Xi, he also trains other surgeons from around the globe on how to use the equipment. And later in the show, Dr. Mizrahi sits down at the Da Vinci Xi for a hands-on look at how he performs his surgeries. It's really amazing.
Yeah, you were really, you know, just fascinated.
I was blown away.
Yeah.
Blown away.
Okay, well.